In recent months, Carla, a 35-year-old woman, started feeling something different. After meals, an uncomfortable sensation, almost like her chest was on fire, deeply bothered her. At first, she ignored the discomfort, blaming it on stress and busy days. But the discomfort began to appear more frequently, at unexpected times. It no longer mattered what she ate. The feeling was always there, silent and constant, especially when she lay down to sleep. Some nights, she would wake up feeling like she was choking, running to the kitchen, trying to calm herself with sips of water. The pain started to interfere with her routine. At times, she even felt a strange pressure in her throat, as if something were stuck there. Carla began to avoid certain foods and started sleeping half-sitting on the couch, but nothing seemed to work. After weeks of this, she finally decided to seek help. What Carla didn't realize was that these symptoms, so common and often underestimated, could be related to something far beyond just a simple post-meal discomfort. Before we dive in, make sure to hit the like button down below and subscribe to the channel. By doing so, you help our content reach more people and stay updated on tips that can transform your health and well-being. Let's get started. And then came the diagnosis. Gastroesophageal reflux is a condition many people face without fully understanding how it really works. On a typical day, it appears as a persistent burning sensation in the chest or throat, especially after a heavy meal. But reflux goes far beyond discomfort. When neglected, it can lead to a range of complications and affects the daily well-being of millions of people. Understanding the causes of this issue is the first step toward finding a treatment that targets the root of the problem, not just temporary relief. Why do we feel that burning sensation? Reflux occurs when stomach acid, essential for digestion, escapes the stomach and flows back into the esophagus, which is more sensitive and easily irritated. Normally, a valve called the lower esophageal sphincter acts as a gate between the stomach and esophagus, opening only to allow food to pass and then closing to keep digestive acids in the stomach. When this valve relaxes at the wrong time or fails to close properly, acid moves up into the esophagus, causing reflux. So, what causes this valve malfunction? Several factors are involved, many of which relate to modern lifestyles. First, diet plays a crucial role. Fatty foods like fried items and fast food relax the sphincter, increasing the likelihood of reflux. The same goes for acidic foods, such as tomato sauces, citrus fruits, chocolate, coffee, and alcoholic beverages, which irritate the esophageal lining and increase acid production. Additionally, large, rushed meals overload the digestive system, straining the valve and encouraging acid leakage. Another important factor is stress. Although silent, stress is a powerful influence on the digestive system. When we're stressed, the body releases hormones that can interfere with digestion and even increase acid production. This makes stress a major culprit in reflux, especially since it often leads to harmful habits like eating too quickly, overeating, seeking comfort foods, which are often heavy, and lying down soon after meals. All risk factors for reflux sufferers. The good news is that there are many ways to treat and, better yet, prevent reflux naturally and effectively. The first and most important approach is to adjust your diet. Choosing easily digestible foods like vegetables, leafy greens, whole grains, and lean proteins helps reduce pressure on the digestive system. Additionally, fruits such as apples, bananas, and melons are great options for those who suffer from reflux, as they tend to be less acidic and gentler on the esophagus. Eating smaller meals more frequently throughout the day is also useful, as it reduces stomach overload. Adopting certain habits after meals also makes a big difference in preventing reflux. One tip is to avoid lying down immediately after eating. Ideally, wait at least 2 hours for your food to be processed. Raising the head of the bed, especially for those who experience reflux at night, is a simple yet effective solution, as the incline helps keep acid in the stomach. When it comes to natural treatments, some alternatives stand out. Ginger tea, for example, is one of the most popular and effective options. Ginger has anti-inflammatory properties and helps soothe the esophageal lining, as well as aiding digestion. Chamomile tea is another good choice, with calming effects that reduce acidity. Aspen hyacinth, Matinus ilicifolia, is known for its protective action on the stomach lining, making it a powerful ally in managing reflux symptoms. Baking soda, though not a solution for daily use, can bring quick relief in emergency situations. Being alkaline, it neutralizes stomach acid, alleviating the burning sensation. However, it should be used with caution and always under medical guidance, as excessive use can disrupt the body's balance. Additionally, melatonin for nighttime reflux has been gaining attention. This supplement helps relax the sphincter and can be especially beneficial for those who struggle to sleep due to reflux. Physical activity also plays an important role in preventing reflux. Exercise helps improve digestion and manage weight, another contributing factor to reflux. However, it's essential to avoid intense activities right after meals, as they can increase stomach pressure and encourage reflux. Low-intensity exercises, such as light walks, are ideal after meals. Managing stress is also essential, especially for those who have identified stress as a reflux trigger. Breathing techniques, yoga, meditation, and even a relaxing hobby are strategies that help reduce tension and improve digestive health. This happens because by reducing stress, the body tends to produce less stomach acid, contributing to a healthy balance. Although less common, persistent cough, chest pain, shortness of breath, and even fever warrant attention. Reflux-induced pneumonia, also called aspiration pneumonia, occurs when stomach acids or food flow up through the esophagus and reach the respiratory tract, making their way to the lungs. This reflux can lead to severe lung inflammation, as gastric material irritates and inflames lung tissue, creating a favorable environment for bacterial infections. People with frequent gastroesophageal reflux disease, GERD, or swallowing difficulties are more susceptible to this condition. Treatment usually requires specific reflux management, with diet and specific medications, as well as antibiotics if an infection is present. Another common consequence of reflux is ulcers. Ulcers are open sores that form in the lining of the stomach, intestines, or esophagus, typically due to erosion of the inner lining of these organs. Gastric and duodenal ulcers, known as peptic ulcers, are the most common and often cause intense stomach pain, especially when fasting or shortly after meals. Ulcers generally result from an imbalance between digestive acids and the mucus layer that protects the stomach and intestines, making the tissue vulnerable to gastric acid. Major causes include infection with the bacterium Helicobacter pylori and prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and aspirin, which can weaken the stomach's protective layer. Stress and an inadequate diet high in alcohol, caffeine, and very acidic foods can also worsen ulcers, although they are not direct causes. Symptoms include burning abdominal pain, a sensation of fullness, nausea, loss of appetite, and, in severe cases, bleeding. Treatment typically combines antibiotics to eradicate H. pylori with medications that reduce acid production, allowing the lining to heal and the ulcer to close. The relationship between Helicobacter pylori and gastritis is direct and quite common, as this bacterium is one of the main causes of stomach lining inflammation. Once it colonizes the gastric mucosa, H. pylori releases enzymes and toxins that damage mucosal cells, triggering a chronic inflammatory response. This process can cause gastritis, which is irritation or inflammation of the stomach walls, leading to symptoms like burning pain, a heavy stomach feeling, nausea, and abdominal discomfort. H. pylori infection is often silent, but can progress to more serious conditions, such as ulcers, and even increase the risk of gastric cancer if left untreated. It is primarily transmitted through direct contact, whether through saliva, contaminated food, or water. In the stomach, H. pylori can resist gastric acid, allowing it to colonize the environment easily and for extended periods. The treatment of gastritis associated with H. pylori involves antibiotics to eliminate the bacteria, along with medications that reduce stomach acidity, such as proton pump inhibitors, allowing the stomach to recover from inflammation. Gastritis and gastroesophageal reflux are interconnected, although they are distinct conditions. Gastritis is inflammation of the stomach lining, often caused by infection with Helicobacter pylori. In contrast, reflux occurs when acidic stomach contents flow back into the esophagus, causing symptoms like heartburn, a bitter taste in the mouth, sore throat, and chest discomfort. When a person has gastritis, the inflammation of the stomach lining can increase sensitivity and acid production in the stomach, worsening reflux symptoms. Additionally, the inflammatory process may weaken the valve between the stomach and esophagus, known as the lower esophageal sphincter, which, when relaxed, allows stomach contents to return to the esophagus. This acid irritates the esophageal walls, causing the characteristic burning sensation of reflux. The interaction between gastritis and reflux creates a complex cycle where gastritis intensifies reflux episodes and reflux, in turn, can further aggravate stomach and esophageal irritation. This cycle can lead to complications such as esophagitis and ulcers, requiring treatment that typically combines medications to reduce acidity and restore the mucosa of the stomach and esophagus, along with dietary and lifestyle changes. In short, reflux may seem harmless to some, but its impact on quality of life is significant and can be managed with simple measures. By adopting a balanced diet, improving daily habits, and utilizing natural treatments, it's possible to control and even eliminate symptoms, offering a life with more well-being and without the discomfort of reflux. If this video helped you, don't forget to like it and subscribe to the channel so you won't miss any important tips. Share it with anyone you know who might need it too. We'll see you in the next video. Take good care of yourself and see you soon.